The Indian government has asked states to take on a war footing towards COVID-19. It's telling them to prepare for a surge in infections. Officials are jumping into action as total Omicron cases cross 200. Ishan Garg with this report.
The federal government is allowing local officials to impose night curfews and restrictions on large gatherings. These measures can kick in if the positivity rate of COVID-19 tests touches the 10% mark or if 40% of ICU beds in a district are occupied. District officials have also been advised to closely study the trend of infection in their areas to preempt an outbreak. If needed, they may impose curbs on movement even if case positivity is low. Authorities say the Omicron COVID-19 variant is 3 times as transmissible as the currently dominant Delta variant. But the head of the government-controlled All India Institute of Medical Sciences, Dr. Randeep Guleria, believes getting vaccinated and following COVID-appropriate behavior are still the best way for people to protect themselves. Even though the government had planned to fully vaccinate more than 940 million adults by the end of the year, it has barely managed 2/3 of that number. So now state officials are being asked to focus on increasing immunization in cities where vaccination rates are lower than the national average. COVID care centers that were shut as cases fell are now being reopened again. The government has also launched a program to train hospital staff in using medical oxygen wisely to avoid a shortage. Prime Minister Narendra Modi is likely to meet senior officials on Thursday to review preparations. It's expected that officials will be asked to focus on ramping up vaccination and prohibiting mass gatherings. Authorities say they're aggressively testing and tracking to prevent Omicron from spreading fast. But given India's low genome sequencing numbers, experts say that the real number of Omicron cases in the country could be much higher than the official number of cases. This would mean that the highly virulent strain could be spreading undetected through the country already. Ishan Garg, CNA, New Delhi.